Many members of Maine's medical community are coming out against President Donald Trump's executive order to change the recommendations for childhood vaccinations. That's in part over concerns some parents might trust the president's directive over their own doctor's advice. News Center Maine's Christian Harsa spoke with Maine experts on why they say the new policy is baseless.
Absolutely not. There's no new scientific evidence to justify any changes in the vaccine schedule.
Dr. Brian Youth has been vaccinating kids his whole pediatric career.
About 30 years.
And in Maine, that is not changing, even after President Donald Trump signed an executive order changing the federal recommendations for vaccines.
There was probably an expletive or two.
Maine Medical Association President Dr. James Jarvis says he and the top brass of Maine's medical community were on a video call when the executive order was signed.
We need to, come together right away and say that vaccines are safe and effective and the best thing that we have to prevent illnesses in children.
The executive order reduced the number of vaccines recommended from 18 to 11. And it breaks up the MMR vaccine, mumps, measles, and rubella, the vaccine that was created in 1971, into 3 different shots given over 3 different appointments. Both the letter penned by 7 different groups and a release from Governor Janet Mills and the Maine CDC director solidified Maine's stance.
This will cause no changes to how we're operating and how we're providing preventative care and vaccines for kids.
But other states may change their policies and advocate less for vaccines. All the more reason to get vaccinated, says Dr. Jarvis, pointing to the recent rise in measles as a good example.
We were fortunate that when we had a few measles cases, they were very isolated, and partly that's due to the fact that we have a very high vaccination rate amongst our school-age children.
News Center Maine political brew analyst and pharmacist Joe Bruno has long advocated for vaccines and says after reviewing the executive order, he doesn't anticipate retribution for states like Maine that don't side with the president.
Because all the states have a right to set their own requirements on vaccinations needed for schools and any other activities. So I think the state is just going to stay the course. I don't see it changing at all.
As for the fear the president's directive builds skepticism, Dr. Youth welcomes the conversations.
I love having those conversations. And to me, again, that says that families trust the healthcare system and they trust their provider as they should.
Christian Harsa, News Center Maine.
The president maintains the changes his directive calls for are backed up by science. However, the Maine Medical Association encourages you to talk to your own doctor about vaccines. You can also find resources on the Maine CDC's website.